Hi there, Neil Franks, Green Party parliamentary candidate for the 2024 general election. This is my third video I'm sort of putting together. Again, unscripted, though I do have some notes with us. The first one is a little bit about me and why I'm standing for the general election, and the second one is to do with the kind of what I'd like to see around the town centres and connecting up to our villages, etc. There's a little bit of that in this one as well, because I'm going to be talking about the NHS, something I'm very passionate about, something I've campaigned on for a long time. The 2012 Health and Social Care Act came in. Not many people do know about it. It's sort of consigned to history a bit, but it was the real start of decoupling a national health service. Now, we all know Labour, when they were last in, they brought in PFI. Our NHS is still suffering from the PFI that they brought in. Worcester's paying out a fortune. It was, people would say that the hospital was designed wrong to start with, but we still have PFI costs in many of our hospitals around in the NHS. Sadly, I think they're going to be doing the same again. They've already talked about contracting out. They have mentioned sort of private finance again, and the GB Energy will probably be the future PFI scandal. It's not an energy company like they keep talking about. It will not buy energy. It will not sell energy. It will not produce any energy. It's basically just an investment arm to make the rich richer, and the rest of us will probably maintain high energy bills, because I just don't think it's going to bring energy prices down, or if anything, by much. Certainly not in the way we would. But I'm hoping to cover that a little bit about in the next video, to do with climate change and how actually the solutions for climate change can benefit us all. So with the NHS, 2012's Health and Social Care Act, the Health Secretary decoupled themselves from providing a health service. I don't know if many people know that. It wasn't their duty any longer. And then they changed the way the trusts work into all sorts of different bodies, and they kept changing it as well. So it became harder and harder to keep up with what was actually happening. We've seen deaths in the NHS climb over these many years. I have marched in London. I have marched in Worcester. I have sat on panels in meetings in Evesham, trying to sort of highlight the problems that the NHS was facing. And unfortunately, other events took over elections, and the NHS sort of has only really started to be looked at, thankfully, as an election issue more recently. But I do worry about the incoming government, which is most likely going to be Labour, is not going to be a friend to the NHS. And the idea that they're going to use private sector capacity. There is no private sector capacity. The private sector does not have 100 doctors on standby just in case West Streeton is going to give them lots of work. They don't have all the nurses. They don't have all these beds. The capacity will come from transferring nurses and doctors and other NHS staff to the private sector through outsourcing. That's what's going to happen. And the idea that he's going to build up capacity in the public NHS behind that, again, look at where they get their money from. People with a lot of vested interest in the private healthcare system. So I don't trust them or believe them on that one bit. And certainly the current Conservative government, they're not worth even talking about. They've clearly no interest in the NHS, no matter how much they try and spin it that they do. So the NHS, it is losing billions of pounds every year in outsourcing private profits. They have not made it any more efficient. Health outcomes have gone down as more outsourcing has been given out. And that's, Nuffield Trust and other people will tell you that is the case. So what did the Green Party want to do? What would I be fighting for as your MP if I was lucky enough to be selected as your MP? The first thing I would like to see happen is the funding for another GP practice in Evesham and another one in Droitwich. I think both towns are lacking that extra GP practice. that would mean more in-person appointments, and it would go back to the days when doctors could actually spend a little bit of time with their patients to get to know them more and understand more about what's going on. And that is important because that will improve health outcomes. And there's lots of times when the Green Party will talk about spending money. We're not great at telling people where those savings are. So I'm going to try and put in a few bits and pieces in the middle of this. And if we have people being looked after by their doctors more than they currently are, and doctors do a great job. I love our NHS staff. My mum's been in hospital a lot over the last couple of years, and NHS staff have just been an absolute godsend in looking after her. So believe me, I'm very passionate about NHS staff and getting them a good deal with wages, etc. So the health outcomes will be improved, and that will mean more people will be in work. I'm not saying that's my primary aim of improving the NHS is to get more people into work, but that's naturally what would happen. That would mean more economic activity, more taxes, etc., going back into the system. It's simple as that. The Green Party would also like to invest in more diagnosis centres locally, so people could be any ailments that they have could be diagnosed a lot faster and quicker. Instead of having to get appointments for so many months' time to see a specialist, we would try and push in more sort of specialist diagnosis centres into the local area. So like Evesham Hospital would be a great one where there potentially could be capacity either in there already or developed because there is a bit of space there that could become a new diagnostic centre. So that would be paid through an investment of £6 billion in the first year, and that would increase each year up to £28 billion per year by the fifth year. So that's a massive investment, more than any other party is promising. It's as simple as that, and that is what is needed. The idea that there's massive inefficiency, of course there's a bit of inefficiency, there's always in a big organisation, but the idea that massive inefficiency is going to solve the problems that we have in the NHS is wrong. It's a lie that's put out by certain sectors of the media and politicians because they want you to think that it doesn't need any more money. It does need more money. And there's no real more efficiency. The efficiency is getting worse because of the lack of investment. If you take, one of the things we would do is put the money into pay rises. Now, obviously, doctors are demanding 35%, and a lot of people say, well, nobody else is getting that, why should they? Well, that's because that's what they've lost over time where inflation has been higher than their rise. And it's the same for nurses. When you're effectively taking a pay cut of 2-3% every single year because inflation is higher than your rise of 1%, then you're taking a pay cut. As simple as that. So asking for that to be restored is actually a reasonable and fair ask, and I'm completely behind our staff having that fair pay rise. Now think about what that would mean. It would mean more staff staying in their jobs, better staff retention. I think there's many other ways in which we could look at helping to look after NHS staff, and I do worry about long, late shifts and people being too tired to drive, etc. So that would, to me, go back into having a full transport system, and if it's after certain times, then possibly taxis, etc., to sort of look after our staff because they should be looked after. So if we pay them properly, look after them, we'll retain more staff. If we retain more staff, we won't have to bring in so many bank staff, and that is very expensive. So that would be a big saving straight away. So yeah, I'm not saying it pays for all of the increases, but it should be taken into account, and it's not at the moment. So that's the sort of year-on-year increases that we're looking at. And the other one we would do is £20 billion over the lifetime of the Parliament, which would be investing in new buildings and repairing existing ones. Now, if you have kept an eye on what's going on with the NHS, you will know that the repair bills have been rising and rising, and the amount of money that's there for it has been pulled away. And even it wasn't that long ago. It doesn't feel like it was that long ago that even Osborne pulled £1 billion after telling everybody he'd invested more money in the NHS. He'd done so much for the NHS, but actually he was pulling money away from it. But it was one of those little lines in the budget that get hidden away, and certain sectors of the press are never going to really tell you that. So, £20 billion. Let's get building our NHS back up. Let's get our buildings operating, so they're health and safety wise. Similar sort of investments are going to be done in schools and other buildings. So it's not just hospitals. We would be massively investing in all of our public sectors. The other thing we'd like to do is, again, if you watched my last video about retrofitting, that would be a big area that we'd be doing as well. Because if you start insulating and putting renewables on public sector buildings, massively reducing their energy bills and obviously the carbon impact, etc. But that would be money freed up, go back into the frontline services. So other areas that we'd be investing in is obviously NHS dentistry. I think it's just completely wrong that NHS dentistry is not part of our NHS. And I think I would be pushing for more NHS dentistry in Droitwich, Evesham, and where applicable in the villages, so we can get people looking after their teeth again. Because I have talked to people who have basically said they have had to forego treatment because they can't afford it. And I just, that's completely wrong. So it makes sense again for it to become part of the NHS. That will take time, undoubtedly, but it should be on a roadmap for getting there. Obviously, things like mental health investment, got to start treating mental health the same as physical health. I think at the moment it's obviously difficult in some ways for some people to see that, because we have such huge queues of people waiting for operations, and obviously lack of GP appointments. So it is difficult. I can understand why people don't see it necessarily as a big priority, but it does need to become a big priority. And it will have, again, economic benefits. It's not just pie in the sky thinking. It's if we invest in these things, it improves people's lives, and it also improves the economic aspects of the country as well. But again, economic side of it is not my priority, but it is a feature of what would happen. And the other side is social care. So big investments in social care. Everyone's heard the bed blocking. That's because of the lack of investment in social care. Start paying people properly. Start taking control of it and making the whole sector public again. Big efficiency savings in doing that. And then we can start releasing people out of the hospitals, freeing up beds, and that efficiency starts coming back into the system. And then you will have more operations, more people being treated in the NHS. So again, it is not waste. There is a bit of waste. It can be tackled, I'm sure, for the most part. There's not, the inefficiency is caused because of the lack of investment. And yeah, if you ask anybody about who knows anything about the NHS, they will tell you something very, very similar to what I'm telling you now. Okay, I'll leave it there. That's it for this video, and I'll catch up with you soon. Thank you. Bye.